We all want to look and feel our best, and there is a place to come to that lets us feel that way, and pretty quickly. Greenspring Medical Aesthetics, and this is where we are today. And we're going to walk you through a procedure that you might be interested in, and we explain what it is. I'm sure you will be. Dr. Cadu is joining us right now. It's great to see you again, Doctor, as well as Dr. Nichols. And Jessica is going to be our patient today. We're going to be doing a treatment with Kybella, and that's going to be helping out with the chin area. I think a woman's profile is so beautiful, and so when we see ourselves in pictures, it may not be exactly what we want it to be. So how does this help women who are concerned about that?
Well, what Kybella will do is permanently reduce the fat under the chin especially, but also jowls in a man or woman. A lot of men are very concerned about the fat on their neck. And Dr. Nichols previously did a very comprehensive evaluation with Jess, and Jess expressed that this was really bothering her. And it's a familial trait. It's nothing she's doing wrong. Jess is an athlete. She eats properly, has a healthy lifestyle. But the fat wants to be in certain areas, and in some people, this is one of them. So Dr. Nichols has assessed her just before this. She's put marks that will guide her treatment. Jess will need to come back several times, about once every 6 weeks, and probably after about 4 treatments, this will be gone, and she'll have a nice, sharply defined jawline that does look beautiful.
It does make a difference. Then we can confidently put our hair back and feel like we have that beautifully sculpted chin area.
That's right.
And you know, with men too, I noticed that it tends to kind of drag the face down, I guess in both sexes, but especially with men, I think it ages them. So not a lot of men are familiar with this, but let's start walking through the process of what Dr. Nichols is going to be doing.
Got it. Well, Denise is going to be assisting Dr. Nichols. As I say, Dr. Nichols has expertly pre-marked, so she knows exactly how to guide her treatment. And she will sculpt the chin and neck area by selectively removing fat where it is interfering with that beautifully sculpted jawline. It'll be done with these very fine needles. The needles you barely feel the puncture, but you will feel a burning sensation after the administration of the medication. So we'll get going.
Okay. Yeah. But all worth it, right, Jessica?
That's all worth it.
Now, go ahead, please, doctor.
The medication being injected is called Kybella. That's a brand name for a chemical called deoxycholic acid, which sounds terrible, and it is a little caustic, but it's in our bodies right now. It's actually a bile salt. So our liver makes it. That's not where this material comes from. This is manufactured synthetically, but it happens to be a natural product. And every time Dr. Nichols injects a little bit in each injection site, just the right amount in each site, that is right now permanently destroying a portion of the fat in that area.
Okay, so it's not gradual, it's happening right now.
It's happening right now. Now what will happen is that Jess will have some swelling and possibly some bruising, and that may last a week or 2. So most people don't mind, they go to work, they don't care. A lot of times it's not that visible, but people feel it. So Jess will feel a heaviness, a fullness of edema or fluid in that area for a week or 2.
Now, when can she come back and have it done again?
We like to wait a minimum of 6 weeks between treatments. We just feel that that will optimize the result. Coming sooner than every 6 weeks could result in treating edema fluid rather than fat.
And how long does this procedure take?
Well, you'll see right now, because Dr. Nichols is just about done, so it takes minutes.
Wow.
And we've taken photos of Jess beforehand. Dr. Nichols carefully took before photos so we can help Jess and help ourselves remember the progress that she's making as she continues her rejuvenation.
This is relatively new?
This is relatively new, a couple of years, maybe 3-4 years. There was an off-label brand that's been around for longer than that, but a specific company, very prominent in the aesthetic industry, made this and has really made it available widely.
Now, you're going to not like me for asking this, and you're probably going to say it differs, but is this one of your favorite procedures in terms of seeing results?
It is. It is not necessarily my favorite procedure in performing it, but the results are so gratifying that I look forward to it. So Jess, you've had your first Kybella treatment. Congratulations.
Thank you.
How does it feel now?
It stings a little bit sore, but honestly, not any intense pain. I would say 2 out of 10.
2 out of 10. That's not too bad for the benefits you're going to get.
Right.
Worth
and,
it.
and as Dr. Nichols mentioned, in about 5 minutes or so, this is going to dissipate and you'll be ever more comfortable. And it's very important that you have had this done by a true expert, because the Kybella does need to be administered at the right tissue depth, the right amount, and in the right location to get a beautifully sculpted and smooth area. We don't want to inject too deep or too superficially because there can be complications. And Dr. Nichols here is as good as he gets at this procedure.
And for a free complimentary consultation, or if you're curious about the procedures done by Dr. Cadu or Dr. Nichols, you can check out one of their 2 Greenspring Medical Aesthetics locations. You can call them at 520-628-8500, or you can simply visit greenspringaesthetics.com.